One of the feelings I experienced and I really had to connect with was my anger at post-diagnosis, not because I'd been diagnosed, but looking back through my life, um, looking back at my life through an autism lens and seeing things that had happened, such as bullying at work. My school years, my secondary school years, were the absolute worst years of my life. And sort of thinking, if only I'd been understood, if only things had been different, if I'd been seen and my struggles had been recognised, my whole life could have been very, very different. And so I've had to sort of work that through. And it's been a very, very difficult, painful process for me, but it's also been a really, really important one.
It's worth mentioning alexithymia, which is a difficulty identifying how you feel and communicating that to other people. This is a really huge issue for a lot of autistic people. When you can't find words to describe the way you feel, it's very hard to communicate to others just what you're feeling inside, what you're thinking, and what your emotions might be. So this can make it very difficult for autistic people to talk to doctors about suicidal feelings.
So many of the people that I have worked with have, over the years, presented with primarily anxiety and depression, and that might be the first thing that they've gone to their GP about. Lots of episodes of heightened anxiety, low mood, which then goes on to be depression, and not necessarily going to the GP about eating disorders. I think they get picked up before they see the GP. But what women have told me over the years is nobody listened to me. So I would go and I would talk about what was going on for me. And I was given a prescription for antidepressants. And yes, they did seem to work for a little while, but actually nobody talked to me about what was going on outside. Nobody talked about relationships. Nobody asked me about my employment. Nobody asked me what it was like for me in education. So there was no joined up thinking about why might this person be presenting with these mental health issues. It was just taken at top surface with their immediate presentation without looking underneath what was going on. And I think that's one of the biggest messages I want to get across, which is please ask the questions. Ask the questions about employment. Ask questions about relationships. Ask questions about what is happening at school. Why are you struggling in school? And I know that GPs are busy, and I know that they only have a very small amount of time. But actually, the fact that these people get missed and misdiagnosed really has a massive impact on their mental health, but also on their life and their potential to achieve both in education and in employment. And if only they could have been picked up earlier. I remember my daughter saying to me when we went to hear from CAMS as to whether she was autistic, her saying to me, and it was a very emotional moment for both of us, when she said, "Mum, if they say I'm not autistic, what does that mean for me now?" And she actually really needed that diagnosis because it then gave her a context to understand who she is. And for many of the clients that I work with, they want a diagnosis to understand who they are, what it means for them. It's not a label, and it's not for us to determine whether that's a label. Because if you've struggled all your life and you have no context to understand why you're on the periphery of society, why you struggle in employment, why you go from job to job, why you never sustain a relationship, there's a reason for all of that. And I know when I've sat with clients, when they've got their diagnosis, it's been the most emotional moment for both of us. And they've cried, but it's sadness that they've been missed. but happiness that they have a context in which to now understand themselves.
Some of the less obvious red flags to be aware of can be sort of some difficulties around change or transitions, things not going as expected, some subtle communication difficulties, perhaps misreading or misinterpreting situations, which can often lead young people to be very vulnerable to being exploited, either financially or sexually. And also that there may be difficulties with bullying or perhaps not quite fitting in and being picked on as a result of that. There are also likely to be sensory challenges, so a certain degree of difficulty tolerating noise or certain smells or tastes or experiences of being in a crowd and things like that.
Although we know that there is premature mortality in autistic people, we don't know the time frame in terms of how it impacts life expectancy. And another factor in these kinds of studies is that we can only look at diagnosed autistic people. So we're missing a large number of autistic people in the population who are undiagnosed. But it's possible that undiagnosed autistic people might be at particular risk of taking their own lives. So a study by Sarah Cassidy interviewed families of people who had taken their own lives about possible autistic characteristics. And her study found that 12 out of 29 of the families that she interviewed reported information that suggested the person was possibly autistic, but none had strong evidence of autism and none had an autism diagnosis.
Trying to work through the different feelings about being autistic, I went through this period of feeling really, really flat, lack of energy. I really thought I was dying at that point. It was just, I had no hope for the future. And so I was having to assimilate all the different feelings I was experiencing about being autistic, how I fitted in with other people, starting to stop being a people pleaser, because throughout my life I've adapted to meet the needs of other people. I know now because I'm autistic, and so starting to put my own boundaries in place. And so relationships were changing. People that had been important to me in my life were no longer so important. Some relationships ended, and then thinking, I'm going to go into older age and I'm going to be completely on my own. And that felt really hard. And however, I've come to a place where I have lovely support around me, people that really see me and get me, and I feel much more sort of optimistic and hopeful. And it was really important that I went through that time, and thankfully I had people there that got me.
I think many women have suicidal ideation because it's a different way of saying, stop the world, I want to get off. If you struggle every single day because the world isn't set up for you and your anxiety is very high and you don't get what you need from other people and you're not necessarily getting what you need from medical professionals, if you just think about how much that's ramped up and ramped up and ramped up and ramped up, as I say it, I think about I might want to stand on the edge of a cliff and jump because nobody's listening to me, nobody's hearing me.
I also just want to highlight loneliness. I have talked about lack of social support, but loneliness is a absolutely critical, fundamental factor in mental ill health and suicidality in autistic people. And there's some suggestion that autistic people get lonelier as they age, which makes sense with the loss of social support networks.
I know when I'm anxious that I have this sort of, my heart races faster, I don't breathe deeply, and I feel a bit of a disconnect from my body, but my head feels separate. And it's to a point that I've had such extreme anxiety, which I haven't recognised until I've been collapsed on the floor in a syncope. So to give an example of extreme anxiety for me, there was a time I went into a tribunal with an autistic client in court, And in the tribunal, I sat there and I started feeling hot and uneasy. I came out of the tribunal, got into the foyer, and I collapsed on the floor and I couldn't move. I find it really difficult to breathe. I had to crawl to the disabled toilet, and I lay in this skanky disabled toilet with the cold floor on my cheek to try and get myself back to some kind of place where I could get up and go back into the tribunal. That is the sort of extremes of autistic anxiety. It was terrifying. I didn't know what was happening until somebody that I worked with said, "Kathy, you're having a panic attack." And I found out more about what having a syncope is about. So that's a dramatic sort of aside of anxiety. I also have extreme anxiety when I have to travel from one place to another, particularly when I don't know where I'm staying. Part of my work is traveling all over the country. I try and stay in hotels and places that I know that are familiar to me. When I go to places that I don't know, I can end up with extremes of anxiety, which can cause me to sort of be violently sick, go hot and cold, and it can feel like sort of sickness bug. It's not, it's extreme anxiety. That's anxiety in its worst form. I'd say that I've assessed hundreds of autistic people, children, adults. Most people experience varying degrees of anxiety, which affect the quality of their life on a daily basis.
Emotion regulation is also a huge issue for autistic people throughout their lives. And suicide is in some ways very much a means of emotion regulation when the emotions of that situation are just so intense and intolerable. Some people seek a means of escaping those emotions and that situation. And autistic people struggle with a lot of issues related to emotion regulation. So, for instance, conditions which are associated with being maladaptive ways of regulating your emotions, such as eating disorders, such as substance use. And autistic people are often very likely to also engage in self-harm, which is also a means of emotion regulation. And there's some suggestion that suicide can sometimes function as a way of emotion regulation when these other means are no longer working.
It's also helpful to know that many of the less obvious autistic presentations may first present to you as something completely different. There might be an eating disorder or concerns about obsessive compulsive disorder, high levels of anxiety and depression, possibly Tourette's and sort of other, or maybe ADHD, something like that, where the autism is not necessarily the first thing that is noticed and only becomes more apparent when the sort of presentation is explored a little deeper.
Some autistic people express that they don't wish to die as such, but that life is just so painful, so frightening, lonely, unbearable that they just want to escape it. And autistic people are more vulnerable when they get to that state, because something that autistic people struggle with generally is flexible thinking, problem solving. So finding ways to resolve life challenges, maybe especially if the way that you'd normally approach that is not possible, it can be very, very difficult for people to find solutions for life's challenges. This is also exacerbated by the fact that a lot of autistic people don't have a lot of social support around them, so they don't have a lot of advice they can seek. So people can get very trapped into ruminative thinking, kind of sticky thinking, and they can't really see any alternative ways out. It's also worth mentioning that when autistic people are in such a vulnerable state, they can experience a kind of regression, essentially, of their usual coping abilities, their usual cognitive skills, their usual means of emotion regulation, such that they are just in this very vulnerable state where they don't really have access to their usual cognitive and emotional resources.
Part of the experience in the hospital, and the reason why it's probably so emotive for me, is the high levels of humiliation and shame that I felt, because as an adult I'd broken down like a baby, sobbing. But that's part of it. I'd reached that point where I had to let go, and meltdowns are part of that reset process, whereby you reach a level where you can't cope anymore, and after the meltdown you get a sense of calm, and you can deal with whatever is actually being put in front of you. And it's a necessary part sometimes, but it's a difficult one to see and difficult one to be part of as well.
Some people really struggle to tolerate intense negative emotions, so suicide and self-injury can be quite a rapid, automatic, urgent response. This is very much associated with the difficulty understanding your emotions, something called alexithymia. And if you have trouble identifying how you feel and communicating that to other people, you tend to have difficulties finding adaptive ways to regulate your emotions. Hence, you might go down these maladaptive pathways of eating disorders, self-injury, or indeed suicidality. It's also important to mention that autistic people greatly rely on the support of other people around them for help with their emotions. So they get external emotion regulation help. And that's something that's likely to dwindle as they get older, especially if they're getting that emotional support from a partner or from their parents, someone that they might not necessarily have access to in older age.
Recognising anxiety in autistic older adults can be about asking the right questions. It might be about changes in behaviour, which could include somebody in general following quite a broad diet and then sort of adapting to a very restricted diet for something that feels comforting and safe for them. It can be more sensory seeking, so skin picking, twirling their hair pulling, trichotillomania, blinking more, having a dry mouth, not breathing as deeply, the sort of typical features that anyone might present with anxiety, plus the sensory seeking, which becomes much more pronounced. It might be not being able to focus, so flitting from one thing to another, not being able to concentrate, would be another question to ask. It might be having that sort of pending sense of doom, really, and not knowing what that's about. Because what we do have to remember is some autistic people have big difficulties connecting to how they're feeling, alexithymia, and so won't necessarily think, oh, I'm anxious. It's just something's there.
One of the biggest issues, particularly facing anyone who is not picked up early as being autistic, is the level of trauma and distress that can be experienced over the course of time before a diagnosis is actually made. And perhaps what's worse than this is the misdiagnosis, particularly of many females or non-binary autistic people, is the misdiagnosis of emotionally unstable or borderline personality disorder, when really all that is a description of distress behaviour. So any young person who comes in with an apparent difficulty regulating their emotions, who may be self-harming or who may be in extreme distress and even be suicidal, is often instantly thought to have some kind of personality disorder. And this is not only incredibly stigmatising, it often results in young people being admitted to inpatient units. In the area where I live, which is Norfolk, some 70 to 80% of the young people in inpatient units in our area are actually autistic young females. And actually the environment for them in these kind of places is not suitable. It's a sensory overload nightmare. They often are misunderstood, and some of their behaviours are misinterpreted as being attention seeking or deliberate acts of behaviour, when in fact they are just signs of distress from an autistic person in burnout. And this not only has implications for increasing the trauma that they experience, it also has potentially long-lasting impact for them, because it will stay on their medical notes. And I've worked with a number of young people who have been given this label and have found it incredibly difficult to get it removed from their medical notes and replaced with the appropriate label or diagnosis for them, which is autistic. And this can have huge implications if there are issues with their own children when they go on to have children of their own. There are people who are deemed to be unsuitable as parents, and they may be investigated as part of some kind of child protection issue. They may even be accused of fabricating their child's difficulties because they have this label of emotionally unstable personality disorder. It is assumed that they must be attention seeking and trying to make up things in order to get attention. And in fact, this is the exact opposite is often the case.
We don't actually know the true prevalence of suicide in autistic people. And what's really worrying is the rates we have are so high, yet the true prevalence is likely even higher. So we know that suicide is the leading cause of death in adults, autistic adults without intellectual disability. We believe that rate is, studies range in their estimations, but it might be up to 9-fold higher than that seen in the general population. We believe 2/3 of autistic adults have experienced suicide ideation, that is the desire to end their own life, and up to half have actually attempted suicide. So it's a very real problem.
So research has been conducted by Gavin Stewart on people who are taking part in a volunteer study of ageing in the UK, which is called the PROTECT study. So Gavin's research involves more than 20,000 adults who are aged over 50 living independently in the community. And from this larger group, he identified 276 people with high autistic traits. And he compared them to about 10,000 comparison people of the same age and sex distribution. So of the 276, only 21 reported that they actually had an autism diagnosis. And in this cohort, most of the sample were women, so 67%, and the vast majority were married or cohabiting, 72% of the high traits group compared to 79% of the comparison group, and the average age was 63. So this study found few differences in the number of physical health diagnoses that were reported for the high autism traits group and the comparison group. But they did see differences in mental health problems. So just over half of the high traits group reported that they had had a depression diagnosis in the past. A third had had an anxiety diagnosis, and 1 in 8 a diagnosis of panic disorder. And more of the high autistic traits group reported current depression or anxiety. So about 1 in 5 reported current depression symptoms, and 1 in 8 anxiety. But the rates in the comparison sample were around 1 in 30 or less. So this was actually a sample with very low rates of mental health problems overall.
We know that the burden of mental illnesses is much higher in autistic people, and that remains the case as they age. And a number of mental illnesses which are associated with greater suicide risk in of themselves, such as eating disorders and substance use, do tend to be higher in autistic populations. We also know that co-occurring conditions like ADHD can be associated with increased risk of suicide. And in part, this may be because of the stigma and the impact of mental illnesses and co-occurring neurodevelopmental conditions on that person's social support and in terms of how stigmatized they are. So loneliness and a lack of social support are emerging again and again as just such critical predictors of mental illness and suicidality in autistic people. They are very, very significant risk factors.
Another analysis that Gavin Stewart conducted on this cohort looked at experiences of neglect and abuse and trauma growing up in these participants. And these were participants who grew up in the 50s, 60s and 70s. And the study found that around 2 in 3 of those with high autistic traits had experienced emotional neglect. So a sense that they had never felt loved by their family, compared to about 1 in 5 comparison people. They also experienced higher rates of emotional abuse, so feeling like someone hated them. So that was reported by about 2 in 5 of the high autistic traits group, compared to about 1 in 10 of the comparison group. And physical abuse was also more common. So being hit so hard that it left marks was reported in about 1 in 4 of the high autistic traits group, compared to about 1 in 10 of the comparison group.
There's 2 cognitive affective states which have been highlighted as risk factors for suicidality in autistic people. One of these is called thwarted belongingness, and this is essentially a state very akin to loneliness, of being disconnected from others, not fitting in, not belonging, having no one that you can care for and who cares for you in return. The other of these states is called perceived burdensomeness, and this is a state where a person feels like a liability, like a burden on others, like their life is worthless and others would be better off without them. And research is highlighting these 2 states as critical risk factors for autistic people and suicide, either in combination or independently of one another.
Rates of self-harm and also attempts to take their own lives were much higher as well in the high autistic traits group. So around 1 in 3 of the high autistic traits group had contemplated hurting themselves many times, compared to about 1 in 16 of the comparison group. Deliberate self-harm was reported by about 1 in 5 of the high autistic traits group, compared to about 1 in 20 of the comparison group. And self-harm with intent to end life in 1 in 8 of the high autistic traits group, compared to 1 in 40 of the comparison group. But autistic people who'd engaged in self-harm were actually slightly more likely to seek help from their GP or another professional compared to the comparison group. So the overall implications of this research, so arguably this research was conducted with probably a very advantaged subset of autistic older adults, in the sense that they have few financial concerns, they're engaged with research, able to participate independently, and they don't show higher rates of diagnosed physical health conditions compared to the comparison group. But despite this, there are substantial differences in mental health and also in the history of adverse experiences. So I think one implication is that older autistic people who might seem to be coping well actually might have difficulties that are going unrecognised, which might be a direct consequence of being misunderstood and blamed and victimised during their lives. And it seems like they need support, particularly with dealing with the impact of traumatic experiences.
It's also worth mentioning that autistic people might respond very literally to questions about suicide. For instance, if you were to ask someone, "Have you ever thought of suicide?" they could respond to that very literally. "Well, I'm thinking about it now because you've just asked me." And finally, it's important to mention that symptoms of mental illness, such as depression and anxiety, very often also present differently in autistic people. So with depression, the most notable symptom in autistic people seems to be anhedonia, a loss of pleasure and interest in things that that person would normally find enjoyable. And that symptom seems to be a lot more notable, a lot more prevalent than, for instance, expressing a low mood and showing signs of a low mood like crying.